We're now going to turn our attention to a parasite of the genitourinary tract. And as unpleasant as that may seem, this one isn't so bad. This is Trichomonas vaginalis, and as its name implies, that's pretty much where we can find it. The good news is most of the time it's asymptomatic. The bad thing is I only said most. Okay, this will be a quick one. This is a flagellate. What does that mean? It means it has flagella. Another organism that we learned about like this one was Giardia. Unlike Giardia, it is not the cause of gastrointestinal disease, but instead major cause of urogenital infections actually throughout the world. Now, we also have to think about this in stages, right? Whenever we're thinking about parasites, we always want to think about what is the stage my patient encountered this parasite in? What is the stage that I can find it in my patient? And what is the stage that I can treat it in? Because if we can kind of answer those three questions, the infective form, the diagnostic form, and the treatment form, then we have a good idea of how we can manage this infection. Now, Trichomonas is strange. We haven't yet observed a cyst stage. That doesn't mean it doesn't exist. It just means that we haven't seen it. All we've been able to find so far is the trophozoite stage. So that is all of the forms you need to know. Trophozoite, that's your infective, your diagnostic, your treatment. It's the whole show. And in this case, because it's a flagella, and this is not unlike Giardia, the reason it actually causes disease is probably due to mechanical irritation and the inflammation as a result of the pathogen being there. And remember, whenever we're thinking about parasites, the type of inflammation we're expecting to see is an eosinophilic inflammation. Eosinophils were basically specially designed for the parasitic war. So unlike amoeba, like let me think, like Entamoeba histolytica, most flagellates are going to move by lashing that flagella, and that's going to get them through fluids. So we're going to see that mechanical disruption. We're not going to see a lot of tissue invasion. We're just more going to see the locomotion being the problem with it. This organism is largely found in the urethras and vaginas of women and the urethras and prostate glands of men. We find it throughout the world, and it can be shared. Its main course, I just threw my pen, that's how excited I was to tell you about this organism, is sexual intercourse or travel through the birth canal. So this is another one that as the baby makes its way through, it might pick up some parting favors along the way. All right, so let's talk about the clinical syndrome. For the most part, you're going to see a trend here. It can be asymptomatic. So there are probably a lot of Trichomonas vaginalis infections out there that we're unaware of just because they're asymptomatic. If anything, in women, we're going to see some watery discharge and maybe some vaginitis as a result of that flagella rapidly beating its way through the tissue and causing inflammation. Men are largely asymptomatic carriers. In very rare cases, we see some prostatitis, just, inflammation of the prostate, but that's about it. Diagnosis, all you're going to do is look for this trophozoite. And you can do that using either GEMSA staining or Pap staining. So that's actually really convenient, right? Because most women, when they go into their practitioner, get a Pap smear. So, when you're doing your annual cervical cancer check or Pap smear check, you can also take a look for Trichomonas. And to treat it, real simple, metronidazole. This one isn't that big a deal, but it is all over the place.